Well, the former wrestler Tyler Mane, known for his role in the X-Men franchise, has been diagnosed with breast cancer, and he is urging other men to get checked.
Mane says he found out that men are more likely to be diagnosed in advanced stages because it's not necessarily talked about or even thought about in some cases. So he wants to spread the word. Joining us to do just that is 9 News medical expert Dr. Payal Kohli. Yeah, I think, that stat alone is probably because it's not really on our radar.
It's not at all. And men have breast tissue, just like women do, but a lot of men don't realize that they can get breast cancer. In fact, 1 out of 100 breast cancers do occur in men.
Oh,
now,
wow.
Obviously, the lifetime risk is really low. It's much more rare in men, right? So 8 out of 8 women, 1 of them will get breast cancer in their life. It'll take 726 to 1,000 men for 1 of them to get breast cancer. But when it happens, guys, it's really, really scary because it usually gets diagnosed in a much more advanced stage, partially because of that lack of awareness, and people don't realize that men can get this type of cancer. So there's 2 types of cancers men can get. One is called invasive ductal carcinoma, and the other is called ductal carcinoma in situ. So it's ductal tissue from the breast, but it's just whether or not it's invaded or not yet.
And Dr. Kohli, another part that to me was pretty heartbreaking, the fact that he hid his diagnosis for so long because he felt, and you can chime in here, is there a stigma attached to men and breast cancer?
There's a huge stigma, Sam, and it's men and the community in general, even physicians, I will say, perceive it as a woman's disease, right? And so the Major League Baseball turns their bats pink on Mother's Day to raise breast cancer awareness, and the ribbon, it's a pink ribbon for breast cancer awareness. So a lot of men feel that it's a sign of lack of masculinity, or it's some kind of a failure that they have this woman's disease. And I think we really need to change that if we're going to change the prognosis for those poor, unfortunate men that do end up getting male breast cancer.
And then I think people who aren't clued in, guys think I don't have breasts, I have pecs. Right? But you're saying it's the tissue. So then how should men, if they're now talking about this, in part because, of this brave decision to come out and talk about it, what kind of symptoms should men be looking for? Because I know women do self-breast exams and they do it at the doctor, but what should guys do?
So we don't screen men on a population level because it's so rare that that's not an efficient way to do it. So it really is up to the man to feel his breasts and look for any changes. And so the most common way they present, similarly to how women present, usually with the lump. Sometimes you'll see it right under the nipple. You can see retraction of the nipple. You can see bloody discharge. A good friend of mine passed from male breast cancer, a vascular surgeon. We were in residency together. He was operating one day and he started having pain in his arm, and he thought he had carpal tunnel from operating too much, and it was actually a lymph node, and so it didn't get picked up until it had spread far beyond the breast, and this is in a physician. So I really want to empower men to not be ashamed and to use this really as a way to open up the stage for this discussion, remove that cloak of shame, start to feel their breast tissue so they know what normal feels like, and that way if it starts to feel abnormal, the skin changes, they are very quick to get it checked out.
Very important information, Dr. Kohli. What about the prognosis? Also, who is most at risk? Is there an age thing? Is it race?
Yeah, so Black people are at higher risk. Age, as we get older, age over 60 to 65, those patients are at higher risk. People with a family history of breast cancer, that significantly increases a male breast cancer risk as well. And then we have these genetic mutations, BRCA, that we've heard of, BRCA mutations, that can increase the risk as well, genetic syndromes, but a lot of lifestyle factors too. So obesity and alcohol use have been closely linked to male breast cancer as well as liver disease. And unfortunately, Sam, the prognosis is not as good as it is for female breast cancer just because it does get picked up later. But if it's picked up earlier, we do a lot of the same things. We do the surgery, we do the radiation, chemotherapy, targeted therapies, hormone therapies. So again, the more men know that this is breast tissue, not pecs, as you said, Phil, and the more they start to feel what normal feels like, the more they'll know when something's abnormal.
It's a good heads up. And it's a really, brave, wonderful thing that he's doing.
It really is. And he was ashamed of it before, he said, and then now he's come out with it. So I want us to use him as really a role model for how we should think about the men in our lives.
Well said, Dr. Kohli. Thank you.